Etripamil is a non-dihydropyridine calcium channel blocker that is now formulated in a way that it can be administered as an intranasal spray and is used to terminate paroxysmal SVT. So the trials that have been done to date were related to the efficacy of the drug. Within 7 minutes, you have sort of peak absorption of the drug. Within 30 minutes, 60% of patients have converted back to sinus rhythm compared to 30% with placebo. On top of that, the time to convert, the median time was 17 minutes as opposed to 53 minutes for the placebo arm. So the efficacy is there. The presentation here at ACC is really looking at the safety side of things. What's nice about this intranasal spray is that it is self-administered outside of a hospital setting. And the reason it can be done that way is that compared to what we had before, which was just either vagal maneuvers or an oral tablet that would take a significant amount of time to actually be absorbed and be effective, now you have very rapid absorption and the ability to terminate the arrhythmia in a short period of time. Safety data is really paramount when you're talking about something that's going to be administered by the patient outside any sort of monitored setting. And so both for clinicians and for patients, they need to know, am I going to be safe taking this? That's what we looked at. We pulled the data from all the clinical trials and looked at the two major concerns that you have. One is hypotension and two is syncope. And what they were able to show is out of 1,600 patients, only 7 cases of hypotension, drop in blood pressure, and only 4 cases of syncope. And even the syncope cases, they had a very interesting definition, 12 hours prior to the administration of the drug to 24 hours after. So in fact, 2 of those fainting episodes occurred before the patient had even taken the medication. So that's very reassuring data, both for the clinician and for the patient, that I can safely administer this. So I think instructing patients is important. When you're having an episode of PSVT, you want to make sure that they know how to use it because they're anxious, they're nervous, they're maybe having some pain, and we tell them to sit down, 1 spray in each nostril, no sort of prep dose, and then just sit and allow time for the medication to take its effect.